Hello everyone, I'm Urologist Erdem Akkaya. Today's topic is sexual inexperience and premature ejaculation. Friends, we get a lot of questions about this topic. More specifically, premature ejaculation is a problem we often see in men who have no sexual experience, whose sex life has just begun. When a person encounters such a problem, he immediately labels himself as premature ejaculation. In fact, this situation improves with the increasing sexual experience of the person, the sexual harmony of the couple and the knowledge of the person. Therefore, it is necessary to wait for a few months. It is necessary to do some research on premature ejaculation. One of the most delicate problems is that if you have an erection problem, if you are not able to maintain an erection and if you are not able to start sexual intercourse, then you also have erectile dysfunction with premature ejaculation. This definitely requires treatment. You do not need to wait, you can go directly to the doctor. But apart from that, if you have a new sex life and experience premature ejaculation, it is quite normal. We already see that as a man ages, the duration of intercourse increases and the frequency of intercourse decreases. Young men ejaculate earlier anyway. But if this process continues for months, if there is premature ejaculation that lasts for 3 or 4 months, it definitely makes sense to see a urologist. Because if you do not pay attention to this problem in the beginning, and then the problem can expand. Many patients come to me, they have a sex life that has lasted for 20 to 30 years, they are married and ejaculate prematurely. After 30 years, they ask if there is a cure for it. So that's important for us. Also, what is important about premature ejaculation? We have already made videos on this topic. The person enters a strange environment. He will experience an intercourse that he has never experienced before. It's like driving a car. Think about how excited you are when you drive a car for the first time, it's like that. You do not know how your partner will react, how you will behave. Of course, there is an adrenaline release, excitement, stress and anxiety. But as the person begins to master his own body over time, you can say that premature ejaculation improves because he sees in which position he feels comfortable, in which he can control himself better. But the person's perspective on sexuality is also an important, friends. If the person sees sexuality as the penis entering and exiting the vagina, then of course problems and couple issues can arise. Because the person ejaculates early, the partner sees the relationship as a service, a routine like preparing a meal. Because she begins to see the intercourse as a situation in which she will not have pleasure, in which the man's needs will be satisfied, sexual aversion begins in the woman. Because she has no expectations of sexuality, she thinks that she will do her duty and end, so she does not want it. But sexuality is about desiring the woman, lusting for the woman knowing that her partner has those feelings for her, or hugging and lying down after intercourse, saying nice words during intercourse or at normal times, and that's how the woman enjoys the intercourse more. Those are important things. Those are actually things that are part of sexuality. The sexuality is also a part of this relationship, the two complete the whole. Sexuality is actually a C. But as I said, one of the most important things is not to immediately call yourself premature ejaculation. It is necessary to wait a little and gain experience. Secondly, if there is erectile dysfunction with premature ejaculation, it is essential to see a urologist without wasting time. Moreover, the knowledge and experience of the person as well as the emotional bond between the couple must be strong. It is very important to go to the doctor as a couple when treating premature ejaculation because the treatment is much easier. Some of the patients who come to me may have female partners who say, "Fix it, then come back." But there are also patient profiles who come to me as a couple and whose partners say, "Doctor, how are we going to solve this disease? I want to feel my femininity, 5 minutes is not enough for me." Of course, those who come as a couple respond much better to treatment. Thank you very much for listening, with kind regards.